heart of the home. Getting you through your day. Radio Al Ansar.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Assalamu alaikum wa rahmatullahi wa barakatuh. You're listening to Medical File, brought to you by the Islamic Medical Association of South Africa. My name is Mumtaz Jahan. I'm a biokineticist and have been in practice for 20 years. Tonight, I would like to welcome listeners from Radio Al Ansar, Radio Islam International, Channel Islam International, Voice of the Cape, Radio 786, and FM radio in PE. So tonight our topic will focus on autism awareness, and joining us online is our guest, Dr. Mark Moodley. Dr. Mark Moodley is a specialist pediatrician in the Durban area. He qualified as a doctor in 2012 at UKZN. He has completed pediatric training in the Free State and has a special interest in children with autism and ADHD. Welcome, Dr. Mark. Dr. Mark. Okay, we're just going to try and get Dr. Mark back. In the meantime, I would like to let our listeners know that any questions or queries comments can be forwarded to our WhatsApp number on 060-904-1056. Dr. Mark, can you hear me now? Dr. Mark, is that you?
Yeah, that's me.
Okay, welcome, Dr. Mark, and thank you for giving us your time tonight.
It's only a pleasure, and it's good to be on studio.
Okay, so I've introduced you, and I believe that you have a special interest in autism and ADHD. As you know, tonight is our discussion is on autism awareness. So I think when people hear autism, their backs go up and there's a lot of fear, and possibly because of lack of info. So can you tell us what exactly is autism and how you would explain it in simple terms to someone who has never heard of it?
Okay, so autism spectrum disorder is a neurodevelopmental disorder. So if I had to explain this to a layperson, it is a child that has challenges with communication and social challenges, with also sensory aspects, for example, sight, touch, hearing, taste, smell. Apart from that, they may have stereotypical movements like hand flapping, rocking, head banging. It's different for each person. So when we say spectrum, we're not saying it's like a straight line from a mild case to a severe case. Think of it as a rainbow having a spectrum. There's different colors. So every child with autism, they are different on the spectrum. One child might be high functioning, and another child might need significant or very substantial support. So the variety in presentation is different for each child. Actually, no two children with autism are the same.
I agree. No two children are the same. Thank you. That puts things in the perspective. So it's difficult to have labels attached. Can you tell us why? You've touched on it a little bit, but can you tell us why it is called autism spectrum disorder?
Yeah, so we used to have different terminology in the past, but the terminology has now changed to autism spectrum disorder. Normally, when we speak about autism, people know it as autism. We speak about neurodivergence. So neurodivergence basically means the brain is wired in a different way compared to a neurotypical person, a person that does not have autism. So like I said before, spectrum means variety in presentations. You may get one child that has autism that could be performing exceptionally well in school, is able to communicate, but does have autism, whereby you may have another child that is totally nonverbal, meaning they're unable to speak at all and needs very substantial and significant support for his or her daily functioning. So that is where spectrum comes in. Yeah.
Hmm. Okay. I like how you worded it there, that the neurodivergent definition just means that you are wired differently to someone else.
Mm.
Um, it makes the labeling a little bit different, hey? Okay,
It
so
does, yeah.
maybe it is because of better diagnosis, but it seems that autism has become more common today. Is this so, or how common is it?
Yeah, so the prevalence of autism is increasing quite alarmingly. It might be that because the criteria is more defined now compared to previously. There's more awareness now, there's more training on healthcare professionals to make the diagnosis, that we are seeing increased cases. Globally, we're sitting at around 1 in 100 children that's on the spectrum. And in some countries, we are as low as 1 in 36. And that is quite an alarming figure. In South Africa, there's over a million children that is being diagnosed. But obviously, there are areas where children don't have access to a specialist or to somebody trained to diagnose autism. So there may be many cases, especially in the rural areas or the overlying areas, where children are not being diagnosed. So there might be more than that.
Yeah, those are quite concerning stats, hey?
Yeah.
You mentioned the rural areas and having access. Are there programs being set up or mobile clinics or anything of that sort that is available to them?
Um, yeah, I think there are some programs that are trying to be implemented and outreach programs. I actually worked in the Uppington area in 2015 when I did my community service. So we had no specialists there. Basically, we worked as medical officers in Uppington, and we were able to identify these cases. Do you know where Uppington is?
Sort of, but you can tell us.
Yeah, it's
I'm
in the northern.
personally from Joburg, so no.
Okay. Okay, so Uppington is in the Northern Cape. It's like at the other end of South Africa, and it's very rural. And we were seeing a lot of cases there. But what we were taught was to identify the early signs of autism and to refer these cases. But there are outreach programs that I believe therapists are going into the areas to pick up these cases. When we go to management, I'll explain why it's important. And now that you brought up that question as well, there is a need for us to implement these programs, to make provision for these programs to be implemented in those areas.
I agree. So as a parent, we generally follow basic guidelines of reaching milestones and, tracking on the
Mm.
sheet when you go to clinics. What are the early signs of autism that parents should look out for?
Yeah, so one of the most important tools that a mother leaves the hospital with, apart from a baby, is the Road to Health booklet. And and that Road to Health booklet that she gets, that green book that she receives, it's very important. There's lots of valuable information in that book, and it will teach you how to. I like how nice the new books are, where it teaches you how to track your baby's milestones. So mommies can read about the milestones, but at every well child visit, a baby needs to go for every well child visit every 3 months or so, not only when the baby is sick or needs immunization. That well
Mm.
child visit should be used as an opportunity for the healthcare professional to start looking at that child's development. Because autism is present in from birth, right? But it's very difficult in the first few months to actually pick it up. But if a child is not responding to their name by, say, 9 months, not using a word by a year, if a
Mm.
child hasn't made any eye contact, when you're feeding baby, there's no eye contact, there's no smiling, alarm bell should start to be ringing at that point, and that child should be referred.
Okay. And this booklet that you mentioned, is that available both at private and public hospitals?
Yes, it's available in the private sector and the public sector. I did a lot of work in the public sector, and the books that have been issued in the public sector, there's lots of valuable information in those books, and it tells you clearly about the milestones. So parents can track it, but healthcare professionals should use it as an opportunity as well at a well child visit to actually see if that child is meeting milestones.
Okay, fantastic. It sounds like you've done a lot of outreach work, so congratulations. So you mentioned obviously looking for things like signs where they're not engaging or not responding to their name. But at what age can an official diagnosis be made?
So diagnosis can start from as early as 18 to 24 months. However, it is very difficult to make a diagnosis at this specific age group. Signs can be present even before 18 to 24 months. Very few kids are actually diagnosed at around this age group. We do get a lot of cases that are diagnosed much later, at around 4 years, 5 years, some even seven, eight. I've also seen kids being diagnosed at 11, 12 because some of these kids they have a speech delay, but obviously it's not been investigated further, and then the parents see that the child is just not speaking and it's not improving, so they seek out care at that point, and then the child receives a diagnosis. So 18 to 24 months, yeah, we can make a diagnosis. We do have screening tools to use at 18, 24 months. We call it MChat, where the parents fill in a questionnaire, which gives us a good idea as to what might be happening. It's a simple questionnaire. But like I've said, most cases are being diagnosed when the child is much, much older.
Okay. Would you say that in the high functioning autistic kids, the diagnosis happens later because the signs are not so apparent?
Yeah, I agree with you. So in the high functioning children, you normally will, some of them are not even diagnosed. They still might be undiagnosed. Some of them will be diagnosed later. Obviously, it needs subspecialist um, a person to diagnose it. There are more extensive screening tools and diagnostic tools. There is a test called the ADOS, which can pick up autism in complex cases. But they're very trained, a few trained professionals also to do these extensive testing. But I do agree with you, these high functioning children, it's often hard to pick up in them. Yeah.
Okay. So with some diagnosis in other areas, there's sometimes a difference in girls and boys. Would you say there are any differences in how autism presents with boys and girls?
Yeah, so boys are more frequently diagnosed. The concern here is that girls are often undiagnosed because they are more verbal, and also girls tend to mask their symptoms for some reason. So they don't display their symptoms as overtly as boys do. So we call it masking, and therefore the diagnosis can go missed in girls. But boys, it's more overt, it's more obvious, so it's easier to diagnose it in boys.
Okay, interesting. Um,
Hmm.
Dr. Mark, in today's society, parents are very conscious of diet, lifestyle, screen time, those sort of things. Are any of these or anything else that you can think of that is related to autism? And do we know what causes autism?
So I know parents are very concerned about the stuff that you just spoke about, like diet and screen time and all of that. But autism, we understand it to be related to genetics, so genes. That's where it is, and focusing on one gene doesn't make any sense because it is a very um, complex genetic, diswiring of everything that causes the child to become autistic. There might be environmental factors that play a role, but the exact cause at this moment is still being researched, still being investigated, and it's not known at this point. But what I can tell you is that genetics is playing a huge role.
Okay, can we delve a bit deeper into that? So when you say genetics, does one of the parents, are they usually also autistic and possibly undiagnosed, or can it even go further, like grandparents? How does it work exactly? Do you know?
You see, that's quite an interesting question. So it all depends on that br baby's brain when that baby is in utero, how that brain is developing, and obviously your genes play a role there. The brain is a rich meshwork of what we call nerve cells and neurons, right? And it's how that brain is being wired. And if there's an environmental factor that's affecting this, we still need to look more into that. I know you did ask me about parents and grandparents. In the older days, no one knew what autism was. But sometimes when you ask parents, they will tell you like there was an aunt or uncle maybe 50 or 60 years ago that wouldn't communicate with other people, that just seemed isolated from the rest. And then you get
Yeah.
this history that there probably was autism in the family at that point, but it just wasn't known
Hmm.
as it is known now. Yeah, yeah.
Okay, and then you've mentioned now in utero things that can affect it. Will this affect how the autism presents for the child? Like, in terms of maybe a high functioning or not?
So that is why I say it also becomes very complicated and very complex because it is a spectrum and the presentations can be different. The genes are affected, but it also depends on how the brain is being wired. So there's no direct indicator to say if this exposure happens, it's going to present in this way. Um, we use the term autism spectrum disorder. If there's a gene that's going to affect it, um, the child will present with autism, but the presentation we cannot predict. Like a certain exposure is going to present in this way. Neither can we predict the severity of it.
Okay, thank you. So, we have a surplus of information at our fingertips, and it's not always helpful or true. What are some common myths or misconceptions about autism that you would like to clear up?
Okay, the first misconception I would like to clear up is that vaccines cause autism. Vaccines do not cause autism. There's been numerous researchers globally to show that vaccines do not cause autism. So I think one of the takeaway messages from our talk tonight is to advise parents to please take their children for their vaccinations as scheduled in the Road to Health booklet. Because remember, if you do not vaccinate a child, the child can get illnesses that's vaccine preventable. And these illnesses
Mm.
can lead to morbidity and even mortality in some children. For example, chickenpox, measles, we get meningococcal disease, which can cause meningitis, pneumococcal, which can cause pneumonia, rotavirus, which can cause acute gastro that can lead to dehydration. So your vaccines are there to prevent a child from acquiring illnesses that can lead to the death of a child. If you look at the under five mortality in South Africa, diarrhea, pneumonia, malnutrition, they're all in the top five. So
Hmm.
parents can be reassured that vaccinations do not cause it. It's been proven with numerous studies, reliable studies. It is a misconception. Please vaccinate. The second misconception is bad parenting. I would like, for people not to think that bad parenting causes autism because we do know that genetics play a role, and that's something that we cannot change. So we need to remove that idea of a bad parent equals a child with autism. It's not bad parenting. It's a very common misconception.
Yes. Okay, well, you basically answered my next question. So, with
Did
that, we're going
I?
to go. Yes, you did. So, I'm going to go to an ad break now, but just for our listeners, vaccinate, 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 and we will come back after this ad break.
unique taste in a paste. Available throughout South Africa, neighboring countries, and also in the UK. Contact us on 031 577 5023 or www.aminaspice.co.za.
At Checkers, our Steakhouse Classic range is crafted for those who take pride in every braai. Each cut is hand-trimmed by our expert butchers, perfectly matured and vacuum-packed for tenderness that melts in your mouth. From man-sized T-bone steak, beef tomahawk, and classic steak cuts, our butchery brings you over 21 Steakhouse Classic steak cuts to choose from, perfectly prepared. Checkers Cowie Park and Westwood Mall. Butchery, bakery, and deli, certified by the NIHD.
Doctors and guests on a Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Assalamu alaikum and welcome back to our listeners. We are joined in studio today by Dr. Mark Moodley, who is a pediatrician with a special interest in ADHD and autism. Thank you, Dr. Mark, once again for joining us. So today is World Health Day. Islamic Medical Association is taking healthcare to the doorsteps of undeserved communities with their 4 fixed clinics and a state-of-the-art mobile clinic in the Durban area, reaching undeserved areas and bringing medical care to all. Your support can help us provide medical checkups and consultations, medications and injections, family planning and antenatal care, immunizations and HIV or AIDS counseling. Donate now and help us keep our clinics running. Phone the Islamic Medical Association office in your area for bank details. Together, we can make healthcare accessible to all. Dr. Mark, are you back with me?
Yes, I'm on.
So before the break, we discussed that vaccinations do not cause autism, neither do parenting styles, which was essentially my next question. So I'll move on to the following question.
I do have two more misconceptions that I needed to mention as well before we went to the vaccination. There's also a misconception that children with autism or individuals with autism cannot form relationships. That is not true. That autism needs to be cured. That is not true because we know there's no cure for it. And that autistic individuals lack emotions. That is also not true.
So essentially, you are saying that an autistic person or as an adult, they can lead a normal, healthy lifestyle.
They can live a normal, healthy lifestyle. They feel deeply. They can connect meaningfully. And they simply express themselves, mom tells, differently. So we need to acknowledge that.
Yeah, one size doesn't fit all, right?
Yes.
Okay, so we have a number of different schooling systems, such as public, private, homeschooling, online, to name a few. What are some challenges that children with autism may experience at school? And is there a type of school that you would recommend is better suited for them?
Okay, so in the school setting, obviously, you need to have social interaction. So that's going to be a challenge for these children, interacting and communicating with the other children, but also the relationship between the teacher and the child as well. So I think I did speak before about having awareness programs in schools and educating teachers on what to pick up. Why would a child with autism present in this way? Having these awareness programs in schools, because teachers are often the first point of contact in most cases in these children. Parents may not see the signs, but the teacher spends a lot of time with that child. And the teacher might pick up that this specific child is not making as much eye contact with me, or this other child may not be as sociable as the other children. They would know that something is not making sense in this child compared to another child. And they should raise up those concerns with the parents if they feel like it may be a concern. In the classroom, remember, it's also a lot of children and spacing might be an issue, especially in our government settings as well. So we did speak about sensory processing being a challenge in these children. So in our small classrooms with a lot of noise, with bright lights, it will cause that child to have a sensory overload, and those children normally will have a meltdown. A meltdown is not a temper tantrum, it's just a way they manifest when they cannot express themselves verbally due to sensory overload. Classrooms, there can be changes in routine, moving to new classrooms, changes in the education routine, the way of teaching. So that can also upset children with autism. They don't like routines to be changed. Not all of them, some of them. And also communication differences can also be a challenge in schools. I think the main takeaway message in this question is to to try and implement awareness programs and educative sort of programs in schools, mainstream schools and in special schools. Normally,
Hmm.
your occupational therapist and your speech therapist and the doctors work as a team and they decide the severity of the autism. Is this child okay to go to a mainstream school, or should we maybe consider a special school for this child?
Okay, all right. Do these education programs happen? Do you know of them being present within schools?
I don't know of many, but I'm trying to do a few just to
Okay.
go to, yeah. So I do have a team of therapists as well that I work with, and we did speak about actually educating the educators on it so that they can learn the science. But I think it'll help if more people can get involved and make teamwork, especially with our educators. And a lot of our educators are open to learning about it, and they want to know about what to watch for, what to pick up on. So I think it's going to take teamwork to do something like this.
Sure. And is it becoming more accepting that autistic kids are being accepted within mainstream schools?
Yeah, we still need to look at the statistics with acceptance. There's not a lot of research regarding exact numbers telling you about
Hmm.
acceptance. But what I can tell you is that acceptance is becoming a problem. We look at, April is Autism Awareness Month, and we celebrate Autism Day on the 2nd of April. And this year, we actually moved from navigating from autism awareness to autism acceptance because we want these children and their families to be, when we say accepting them, it means that we are including them in a world that's not neurodivergent.
Yes.
So, yeah, yeah.
Okay. So let's talk about the positives. What strengths do individuals with autism have?
Yes, I think it's good that we're going to the positives because there's a lot of positives in children with autism. I've seen children that are very talented, that they play musical instruments beautifully. I've met children with beautiful talents in art, in painting. There was a child that made a T-shirt for me with my name and my logo from Cape Town, and it was beautiful. Yeah, so we actually bypass the talents of these children, and we don't see it. And it's
Hmm.
important to actually see the good attributes that comes out of it, and acknowledge those attributes. They can have very strong attention to detail, and even basic virtues like honesty, reliability, unique problem-solving skills. To be honest, it's a variety of qualities that's quite unique and leaves a lasting impression in you meet some of these children, you'll actually leave a lasting impression on you on what you see this child can actually do. Yeah, I still have that T-shirt that child made for me 3 years ago, and whenever I see it, I just think there's such talent in these children that we often bypass and we don't see.
That's such a lovely story. I'm smiling as you're saying it. It sounds like they look for an outlet, you know. I mean, maybe
Yeah.
speech is not their outlet, so they look for a different way.
Yes. Yes.
Okay. So a diagnosis can't be easy for parents to hear or to accept.
Mm.
How would you say families can better support their child with autism?
Yeah, so no parent, we spoke about 1 in 36 now, the prevalence actually becoming more common, and it's becoming more common as we go along. So a lot of parents are, and even young parents, newly married parents, they are getting the diagnosis now. So it's not It's not an easy diagnosis. We used to use the C word previously. Now it's the A word.
Mm.
So to break the diagnosis, so it's very, very difficult and challenging to break the diagnosis of autism spectrum disorder to parents. Once they get the diagnosis, their whole world changes at that point. So I think we need to start with acceptance, because without acceptance, it's very difficult to navigate around management. When you accept a diagnosis, which is also quite difficult, then it's likely that you will go ahead and go with management. But when you're in a stage of denial, it makes management very difficult. But like I've said, acceptance is also, we acknowledge that that is difficult for parents. So this is where we need to step into raising awareness of this. If the
Mm.
community is aware what autism is, it's not a child that's badly behaved. It is not because of a bad parent or what a parent has done. It is a medical condition due to genetics, and this is why the child behaves in this way. If people are aware of this, it could lead to more acceptance, and and the parents being able to treat it less of a stigma and seek out treatment.
Yeah, it sounds like knowledge is key, and I feel that excuse me, denial will lead them to not seek the right help. It will delay that help.
It
So
will,
acceptance is probably the sooner it happens, the better.
yeah, like doing a show like this and speaking about it, I'm sure our listeners now are getting a grasp of what autism actually is. So, and I hope it helps people and helps the community to understand what it is, so that they could provide the relevant support to somebody that they know maybe going through this very difficult diagnosis.
100%. I certainly am getting a different perspective. Um,
Okay.
so, Dr. Mark, I'm in the therapy space as a biokineticist, and I'm interested to know what you believe to be the best types of therapies or interventions which can be most helpful for children with autism.
Yeah, so a bit of the old school when it comes to the treatment of autism. I know there's many treatments out there, but your speech therapist and your occupational therapist are the most valuable members in your team. Your speech therapist there, yeah, is there to help you with the communication, to teach you methods on how to help your child to communicate, like picture boards, to assess feeding difficulties. These children can have feeding difficulties. And your occupational therapist is there to assist you with activities of daily living. What is this child functionality like? Some of these children may have intellectual disabilities, to help you in that area, and also with the sensory processing problems. Your occupational therapist can do something called sensory integration therapy to help them in that area. And then a dietitian is very important, because these children are very fussy eaters. They can have sensory issues. For example, the texture of foods. They may prevent certain foods, leading to constipation, leading to reflux. So your dietitian is important to help tailor a diet for the child. Um, the psychologist is important, especially for the parents if they're struggling with the diagnosis, and for the family. Um, you said you're a
Yes, a biokineticist.
biokineticist. I'm not sure how you would help us here.
Or maybe I can, we use exercise as our therapy
Yeah,
mode of therapy. So I have
yeah,
had a few autistic kids.
yeah,
Again, I mentioned the word outlet, and I think
yes.
that's where we fit into that space, to just give them a different outlet, and obviously to keep them active and keep their muscle tone where it should be, and that sort of thing.
Yeah, I think the child with autism can benefit from all our allied health team workers, healthcare providers. We all have a role to. It's not just the doctor that makes the diagnosis. The whole team, the management is the whole team involved, multidisciplinary approach that can help the child. Yeah, and then
Yeah.
teaching the parents how to be therapists at home for their child as well.
100%. Therapy continues at home, hey?
Yes,
And I
yes,
think that multidisciplinary approach is very important.
yes, yes.
Okay, so you mentioned diagnosis can happen from 18 to 24 months, but sometimes even up to 11 years. Um, and so we touched a little bit on this, but how important is early intervention? Like, can it change how the child presents or not?
Yeah, so early intervention is critical. So the earlier you intervene, the research has shown that the outcomes can be better. So you don't have to make the diagnosis of autism, but if you start the treatment for autism spectrum disorder, which is speech therapy and occupational therapy, that's it, speech and OT. If you
Mm,
start it, and you may not have a diagnosis at that point, that's not the main thing. It's starting the therapy. You have nothing to lose. If you find that this child is deficient with speech or this behavior characteristic of autism and you refer the child to speech and OT, already you have done the right thing and you're on the right path. Also, parents, when they get the diagnosis, I advise them. I know they will be in denial sometimes and they will hesitate to go for speech and OT, but start the speech and OT, especially when you're getting it at an early age, like 2 to 3 years. That's a golden gap for the child. And research has shown that it can improve progress in a child quite efficiently.
okay, fantastic. So let's look back at my school question. What role, so with the education that we discussed, what role do you think teachers and schools play in supporting these autistic children?
Yes, so teachers, they play a huge role in that, like we said before, they often are the first point of contact for the child, and they spend more time with the child than the parents. So they are able to identify certain red flags that the parent might miss. So if we implement these awareness programs in schools, teaching them, they will be able to identify, the red flags and then refer them. And also, if you educate them on it and make them aware, they might provide a more inclusive a classroom for their child. Because teachers can also experience burnout in schools. I mean, with overcrowding and all of that.
Mm,
So yeah, so we do understand that that is a challenge for them, but also providing an inclusive classroom for these children and adapting teaching methods to accommodate these children. It is challenging, but we can do what we can and help where we can, and providing emotional support for these children and for their parents as well.
yeah, and I suppose that will also make things easier for both the child and the teacher.
100%. Yeah.
Okay, we're going to go to another ad break, and when we come back, we'll continue our discussion.
We'd love to meet you. Pay us a visit. Radio Ansar.
Welcome to Simplex Radio. Visit our showroom for the full range of car audio. Our TV department carries top brands with quality LED panels, full HD to Ultra HD, and now the experience of Super Ultra HD. Visit our theater rooms and transform your home with brands like Onkyo, Integra, Denon, Boston Acoustics, Yamaha, and more for quality audio visual experience. Now available, full range of home appliances. A one-stop shopping experience. Call 031 306 4029 or Kenilworth Park, 202 Brickfield Road, Overport. Simplex Radio, the name you can trust.
Get ready to elevate your fitness game at First Fitness in Durban's Berea. With a spacious free weight area, award-winning equipment, and exclusive ladies-only parking and training level, we've got everything you need to crush your goals. Hit the ground running on our outdoor track or unleash your inner warrior in our MMA and boxing dungeon. Plus, enjoy high security and ample parking. And don't forget to refuel at our halal coffee and health restaurant for the best in coffees, smoothies, and healthy eats. Join us today and redefine your fitness journey. First Fitness, dare to be extraordinary.
In South Africa, countless numbers of sick patients leave their homes at the crack of dawn to join long queues at clinics and public hospitals, many of them suffering pangs of hunger in addition to the symptoms of disease. The Al-Imdad Foundation's Twice for Life teams deliver sandwiches to these patients at more than 40 hospitals and clinics across the country. Help us to keep on relieving hunger. Donate online at alimdad.com or call 0861 786 243 for more information.
Doctors and guests on the Medical Files program will help you with any medical problems you have by giving you advice on air. However, they do not have your full medical history and they have not seen you. Please verify the advice given to you on air with your doctor who knows you better. Neither the doctors nor Radio Al Ansar will be held responsible for any ill health caused by the advice given on Radio Al Ansar.
Welcome back. My name is Momtaz Chahan, and we are joined in studio today by Dr. Mark Mutli, who has a special interest in autism and ADHD. Tonight we are discussing autism awareness. Thank you again, Dr. Mark, for giving us your time tonight.
Well, thank you very much for having me on.
So we left it off where we were discussing schools and how these kids could be absorbed into mainstream schools and what teachers can do to help them. Inclusivity and diversity is important, I think, not just in schools, but in the workplace and in everyday life. How can communities become more inclusive of people with autism? And it sounds like through our discussion that this is something that you're very passionate about and, educating people. So how do we get our communities to be more accepting and to become more inclusive of these kids and then adults?
To promote the acceptance of autism, we need to have more awareness, like the show that we're having now, the interview. It's creating more awareness and educating the community on what autism is, because like you did mention before, it's often associated with myths and misconceptions. If that's cleared out of the way, and if they understand that it is a neurodevelopmental disorder that is genetic in as a cause, then awareness can be increased. Also, accepting these children and making them inclusive in all areas, in our churches, our mosques, our schools, our shopping malls, in the outside world, because we live in a neurotypical world and these children are in a neurodivergent world. So understanding where they come from and including them in our world is very important. Also, creating sensory-friendly places, like where there's not a lot of sensory overload, for example, loud sounds, bright lights, introducing those areas in public places like restaurants, malls, that can be quite accommodating for these children, because parents are often fearful or they reluctant to take their children out to malls because of the sensory overload. So they keep them at home. I don't think that's nice for the child, because the child needs to be exposed to the outside world as well. So they're isolated at home with that child, because the child will have a meltdown if they are overloaded sensory-wise. And then also,
it is understandable, for the parent, because we're not supporting them or giving that space where the child can be themselves. It's difficult to be going out and things.
It's about breaking that stigma as well around autism. That stigma has to be broken, but it's going to take small steps. But I think the more the prevalence is increasing, the more cases we are seeing now, people are becoming more aware, and acceptance might be increasing at this stage, because we're sitting at 1 in 36, like I said, in some countries. So we have to move towards acceptance at this point and inclusivity in schools. And it's not just our children that has autism, there's also adults with autism. So workplaces should incorporate these individuals, inclusive workplaces.
Yes, I think with most things, education and awareness is key. So we spoke about about when a diagnosis can be made and what early interventions may do. So what should someone do if they are suspecting that their child might be on the spectrum?
Okay, so it's very important for parents to trust their instincts if they feel like something's wrong. I always tell the moms, if you feel that something is wrong in your gut about your baby, take your baby to the healthcare professional. Never ignore that instinct. If you feel like the speech is not right, the developmental milestones are not on par, baby is not making eye contact, go to your healthcare professional. You can start even at a clinic and then be referred, upscale to a pediatrician, a neurodevelopmental specialist, psychiatrist, psychologist, that can neurologists that can assist you with the diagnosis, even if the diagnosis is not made at that point, as long as that child has been referred for speech and OT on the interim. So if a parent is concerned, take that child for consultation.
Mum knows best, hey? And I suppose
Yes,
you're saying you'd rather be safe than sorry. You'd rather be told there's nothing wrong than to miss something.
yes, 100%.
What message, Dr. Mudi, would you like to share with parents who have just received a diagnosis for their child?
Okay, this is not an easy one. Yeah, like I said, it's like breaking the diagnosis of the C word, and now it's the A word. So I would like to tell the parents to take a deep breath, but obviously that's not easy to say because no parent wants to hear, mom and dad, your child is on the spectrum. But it's not the end. It's the beginning of, how do I put it? It's the beginning of understanding your child better. Your child is not a different child. Your child is still the same child. And always remember that that child has potential, a purpose, and a future. So the best thing you can do for your child is to start the intervention, speech and OT, and take it from there. We're trying to raise awareness. We're trying to get the community to accept. Just start the therapy and take slow steps. It's not easy at all for a parent to get the diagnosis of autism. It is not easy.
No, I can imagine. I'm a mom of four,
Yeah.
and
Yeah.
it cannot be easy. So you mentioned earlier that your take-home message is vaccinations do not cause autism. But as your parting message for us tonight, what would you like to leave us with?
Um, I think, yeah, so the parting message, um, I don't try to change the child because remember with autism, they all have their own unique presentations, qualities. So don't try to change the child. Rather try to understand that child from the neurodivergent aspect. Um, when we shift from judgment to acceptance, everything changes. So focus more on understanding them and going for your therapy sessions and take it day by day. And make sure you have the right team on board with you to provide you with the support. And then, we all can walk with this on this journey with you together.
Thank you so much, Dr. Mudli. You've definitely given me a different perspective, and I've really learned a lot tonight. So I really want to thank you for taking the time to join us tonight and educating us and creating this awareness. Um, for parents out there, I think Dr. Mudli has given us some hope that it's not all doom and gloom, and there is help out there. We want to also thank our listeners for joining us tonight and our sound engineer for all the background work. And we hope you will join us again next week for the program. Assalamu alaikum wa rahmatullahi wa barakatuh.
On a Medical Files program will help you with any medical problems you have by giving